Hello everyone. In this video, I'll be discussing about the 4T score used for heparin-induced thrombocytopenia bar thrombosis. I have discussed about heparin-induced thrombocytopenia in the anticoagulant video, but this score I have not mentioned there. The 4T score I have not explained there. Now, what is the need for this score? Actually, heparin-induced thrombocytopenia bar thrombosis, as I told, it's mostly clinical diagnosis. However, in real life scenario, when the patients have multiple comorbidities and like so many things are happening in the same patient, especially if the patient is sick, then making a diagnosis of HIT is really difficult because there can be so many other possibilities of having thrombocytopenia. So for that, they have devised a score which is known as the 4T score that will predict the possibility of heparin-induced thrombocytopenia per thrombosis. Now, first of all, what are the components of 4T score? So the first T is thrombocytopenia. First T is thrombocytopenia. The second T is timing of first event. Timing of first event. Remember, this first event, it can be either thrombocytopenia or thrombosis. It can be either thrombocytopenia or thrombosis. Anything can be possible. Then third thing is thrombotic related events. Thrombotic related events. And the fourth one is thrombocytopenia, other causes. Then what are the points per category? We have 0, 1, 2. Now coming to the first T, that is thrombocytopenia. If it is divided into again three types. One is very low nadir, then low nadir, then moderate nadir. Very low nadir, then low nadir, then moderate nadir. Very low nadir means the fall of platelet count is less than 10,000. So fall is less than 10,000 or less than 30% of the initial value. So if the patient has 1 lakh counts and it is dropping to up to 90,000, then it is the score will be 0. Low nadir is the drop of platelet is 10 to 20,000 or a 30 to 50% fall. 30 to 50% fall. Okay, fall. Then moderate nadir means the fall of platelet count from 20,000 to 1 lakh. The fall is by 20,000 to 1 lakh or 50 to 70% fall. By 50 to 70% fall. Okay. So if the fall is less than 10,000 or less than 30% of the initial value, then the score will be 0. If it is 10 to 20,000 fall or 30 to 50% fall, then it is 1 point. If it is 20 to 1 lakh fall or 50 to 70% fall, then it is 2 points. Then timing of first event. I have told previously that most of the cases occur 5 to 14 days or more likely 5 to 10 days after starting the heparin therapy. So if there is a documented occurrence, if there is a documented first event 5 to 10 days after starting the heparin, then it is given as 2 score. Okay, or within 1 day of therapy, if the patient has received heparin, if the patient has already received heparin in last 3 months, or you can tell 100 days. Okay, so if the patient has received heparin in the last 3 months or 100 days, then there is a risk that patient will develop HIT even with the first dose, even on the day 1 of therapy, Okay, so this point is more likely in favor of HIT, so that's why this is given as score 2. Okay, so documented fast event 5 to 10 days after starting therapy or within 1 day of therapy if the patient is already exposed to heparin in the last 3 months. Then if the event is happening in this same period, that is 5 to 10 days, 5 to 10 days after therapy, or within 1 day of therapy if the patient is already exposed. However, this episode is not well documented. This is the episode is not well documented. That means you are not sure about the episode during this period. That is given as score 1. Okay, so time period is same. If it is documented, then it is score 2. If it is not well documented, it is score 1. Then if it is happening before 5 days, that is less than or equal to 4 days, then it is given score 0. Of course, unless the patient is exposed previously to heparin within the last 3 months. So if it is happening within 4 days, unless patient is exposed to heparin in last 3 months, then it is given as 0 point, because it is highly unlikely for HITT. Then thrombotic related events. If there are no thrombus, then score is 0. If there are thrombotic episodes, but those are common thrombotic episodes, like for example, DVT, line-related thrombosis, or a recurrent thrombus. That means already patient had DVT and now the patient is experiencing another episode of DVT, or the patient has a erythematous skin lesion, unlikely to be thrombosis. Unlikely thrombosis. All these things are common, so that's why they're given score of 1. If the patient has a major vessel thrombosis, then we'll give a score of 2. Major vessel thrombosis, or if the patient has skin necrosis or skin lesions at line site of heparin, that is heparin infusion site. The patient has major vessel thrombosis like CVT, or like something like pulmonary embolism, or mesenteric vein thrombosis, or maybe arterial events like stroke, MI, or if the patient has skin necrosis or skin lesions at line site of heparin, they will be given a score of 2. Then regarding other causes of thrombocytopenia, if you have a definite other cause of thrombocytopenia, then it is given score 0. If there is a possibility of other cause of thrombocytopenia, then it is score 1. If no other cause of thrombocytopenia is possible, then it is given score 2. These are the 4 T's. Okay. Then you have to calculate the total score. If the score is coming anything between 6 to 8, that is a high risk of having HITT, high risk. And if the score is 4 to 5, that is intermediate risk. Score is 0 to 3, then that is low risk. So this is about the 4T score, and I have told you about the management of heparin thrombocytopenia by thrombosis. I have told you have to stop the heparin, then you have to give alternative anticoagulants, and you should not give low molecular weight heparin because of cross reactivity. You can give fondaparinux, but now we are preferring better to give argatroban, or you can also give rivaroxaban. Among the direct oral anticoagulants, this point I have not discussed in my previous video, so you can remember among the direct oral anticoagulants, rivaroxaban has been studied extensively, and this can also be given as an alternative anticoagulant in these patients. Okay, so bivalirudin or lepirudin or argatroban or rivaroxaban can be given, and fondaparinux can also be given, but less preferred. So this is about the 4T score of HITT.